We're very lucky here at the hospice to have over 12 acres of beautiful woodland surrounding us, and it's well documented how important that is to people's mental health and well-being.
I think the first approach when new families come into St Joseph Hospice is the lovely woodlands that we have, and they're quite amazed by how big it is, and that we encourage them that if the family are able to go out in the wheelchairs for a little walk, they love that. Getting them out the bed and taking them out round the grounds, and said, oh, Mum loved that, oh, Dad loved that, all the flowers and the trees.
We help over 200 patients a year, and of course we also pride ourselves on taking care of patients' families. And
we have 2 buildings, one San Jose, which has 11 inpatient bedrooms, all single bedrooms. St Francis, we have 8 bedrooms downstairs, and upstairs we have 10 bedrooms, and again, all individual rooms. Majority have bathrooms.
Well, when they're in the rooms, they can see how lovely the rooms are, and they're quite surprised, some of them, when they come in. Didn't realise I was going to such a lovely room. Yeah. And then we encourage them to bring their photographs in. And
one of the things that struck me when I first came here to have a little look around is how beautiful the rooms are. There's a lovely comfy bed. It feels like home.
I've got a lovely room, and there's even squirrels. If you look through the window, you see squirrels running across the garden.
And also throughout the year we have a lot of events going on, and volunteers are involved with that. And we have hairdressers coming in, we have aromatherapy sessions, and all the families love to be involved with that, and they're quite amazed exactly what does happen at St Joseph's Hospice.
At St Joseph's Hospice we care for end-of-life patients. That's any end-of-life diagnosis, including cancers, end-stage COPD, end-stage kidney disease, heart disease, motor neurons, anything that is life-limiting, we will care for them.
It's got to be a vocation to be here because of the sort of illnesses and problems that they're dealing with, and the emotional well-being of the relations as well, the relatives. And they're so kind. They are so kind.
Very lucky to have a GP, and we've also supported by the palliative care consultant from Merseyside Hospital, who comes over weekly to do multidisciplinary team meetings where all patients are discussed at that meeting, and we'll look at the symptoms, the medication they may need, and what care that patient needs and their families need as well. So we'll look at the holistic care of the patients.
A main part of end-of-life care is to keep people pain-free. So we work really hard to manage people's symptoms. Things are reviewed regularly, and if pain's increasing, we can adapt medications as needed.
The care is fantastic, but the nurses, there's something special, and I've said this once before, about the care, because it is genuine, and that's huge.
If they're within the hospice, there's 24-hour nurse cover, so the symptom control can be administered effectively straight away.
As soon as we stepped in the door here, knew that made the right decision, and the staff have just been absolutely fantastic from the beginning. And I think it's 2 things. You feel really comfortable with the medical care, which is obviously important, but just as important is the atmosphere and the attitude of the staff. And it's quite clear that a lot of the staff are deeply committed to working here, which is lovely.
There's some really, really great additional services that they give here. There's a counsellor, that someone, if people are finding it hard to handle that their relatives are here, well, they've got a wonderful family counselling service as well.
You know, we've had some ups and downs with Mum's condition while she's been here, and so it's meant that we've needed to be here in different ways, different times. So there's been nights where we've stopped over because it's been, a difficult night, and that's all just been very relaxed.
I was doing a little bit of totting up quite recently, and I really think that over the last 40 years we must have looked after altogether with patients and families well in excess of 40,000 people that we've reached out to, not just with clinical support but also with bereavement support and complementary therapies that we also offer. And always being here to listen. One of the things that we're very proud of is that anytime people want to come and speak to us, anytime people want to come back to the hospice, we will always make them welcome and have time for them.